PSA is a protein in your blood. It's called prostate-specific antigen. An antigen is a protein, and we can measure the levels of that by a simple blood test. The levels of PSA in your blood vary from the condition that you have and also with your age. So for instance, PSA goes up from the age of about 40, when it should be, the level is 2, 50 it's 3, 64 and 75 and so on. But it can also go up with another variety of conditions, such as benign enlargement of the prostate, or if there's any degree of infection in the prostate. But it can also go up with prostate cancer. And in fact, it can be the earliest indication that you might have prostate cancer, because some elevations of PSA occur when we can't even feel prostate cancer, so that it's an indication of prostate cancer rather than a diagnosis, and that's very important. Furthermore, because there is so much confusion in terms of what the diagnosis might be, it's not a terribly useful test for screening of prostate cancer, which is quite a controversial issue. You do need to have other tests done to confirm whether or not you've got prostate cancer. PSA, though, however, when we know that you have prostate cancer, is an extremely useful test, so that, for instance, we can measure the activity of cancer by simply monitoring a blood test. And there are several parameters that we would use. We look at how quickly a PSA level is going up over time, and that is called PSA velocity. And another very useful thing for us to decide on treatment, etc., is how quickly we say that the PSA doubling time is. So let's say you had a PSA of 8, and we looked to see and get an estimate of how quickly that PSA would double to 16, often indicates how active a cancer is. And in particular, once you've had treatment for prostate cancer, PSA is extremely useful for monitoring how effective that treatment has been. And often when we're looking at patients with prostate cancer, after their treatment, the first indication that there might be trouble coming again is when the PSA level starts to rise. So it's an extremely useful test, but should never be thought of as being the absolute indicator that there is prostate cancer there.